Hi, I'm Dr Andrew Jordan, Rheumatologist at BJC Health in Sydney, Australia. On a previous video I talked about what is Polymyalgia Rheumatica or PMR. Today I want to talk about how I treat this condition. This condition is due to an overactive immune system where it's inflaming your tissues around your joints. The treatment therefore is to reduce the inflammation in your body. Typically, you may have tried Panadol or non-steroidal anti-inflammatories, and you probably found that they're not very effective, and that's because they're not very good at treating the underlying inflammation in the body, even though they're called anti-inflammatory medications. The main way we treat PMR is corticosteroids, commonly called Prednisone. An important thing to know is that you don't need a very high dose of Prednisone. So a high dose may be 50 milligrams, which you might treat for a lung infection or asthma or some other serious inflammatory conditions. With PMR, you often need a dose to start with of around 15 or 20 milligrams. This will vary a bit depending on your treating doctor. And you'll find that your symptoms usually improve within a few days, almost like it's a miracle. The challenge then is that this condition needs treatment typically for a couple of years. An average person might be 18 months to 2 years on prednisone. So the whole aim of the treatment is how can we use this highly effective medication without causing the side effects that are very well known from prednisone. So the way I treat it is typically start at 15 milligrams and then very gradually reduce it. This may mean 15 milligrams for a month, 12.5 milligrams, down to 10 milligrams, and then frequently it'll be a 1 milligram drop per month or even 1 milligram every 2 months. Again, it depends on how you're going, how much inflammation you have, what the preference of your treating doctor is. But the general understanding is that it's a very slow reduction over quite a long period of time. If you try to reduce it too quickly, it's common that it'll flare up. When this happens, you'll get some of your pain and stiffness back, and you'll usually recognize this as similar to what you had before. If you have a flare like this, you don't need to go back to the start. Often you'll just need to increase the prednisone by 1 or 2 milligrams, get it back under control, and start again. There's about 10% of people who may need prednisone indefinitely. If you're one of the unlucky ones like that, we generally try to keep it as low as possible, definitely under 5 milligrams where we know the side effect profile is nowhere near as much. If your condition is proving hard to treat and you're needing a lot of prednisone, hard to reduce the dose, sometimes a medication like methotrexate may also be used. This is called a steroid sparing agent, and it allows a more rapid reduction of prednisone if it's proving difficult. But generally the main treatment is prednisone alone, and often at the lower end of the dose spectrum. I hope you find that useful as a general overview. Please talk to your treating doctor about any of the concerns with prednisone, or feel free to leave a comment or suggestion below.